Joe, you recording? All right. So good afternoon, everyone. We'll go ahead and get started. Thank you for joining us on the call this afternoon. We certainly hope that you, your families, your employees are all doing well. I stated this morning. It does require that I say it again. I'm sitting at my home office, and I think that I have my two boys occupied for the next hour. But if you hear Dad, 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 I just wanted to apologize in advance. So this is an understatement, but we all have received a lot of information over the past couple of weeks. The goal of this presentation is to provide a condensed snapshot of information that is most important to help you navigate the new and hopefully short-term landscape. I would like to thank Mary Frank and Wendy Ryan and the entire Preferred Benefits staff for compiling all the information and keeping us up to date. So I'm going to start off the meeting today discussing carrier updates. Joe, can you flip to the next slide? Thanks, sir. I'm going to start off discussing carrier updates, and then we'll turn it over to Wendy, who will discuss employee leave requirements as well as the extended FMLA. During the presentation or after the presentation, if you have any questions, you can email them to info@prefben.com or mary@prefben.com. We'll put this slide up at the very end of the presentation as well. Mary will be emailing the slide deck out, and we'll follow up early next week with a list of all the answers to the questions, and we'll email those out to all the participants as well. Once again, we'll show this slide at the end of the presentation, so let's go ahead and get started discussing health insurance carrier updates. So most medical carriers are offering a 60-day grace period for health insurance premiums. Aetna has set up a toll-free number to call, while others are asking that you connect with your billing rep. And you can typically find the name and number of your billing representative on a recent invoice. But if you do need assistance, email us or submit a question, and we will try to provide you with that information. So far, Cigna has yet to release any guidance. All carriers are allowing companies to continue and cover employees that are furloughed or laid off until May 31st, 2020. And I assume that this date would be extended if needed. All carriers are also offering free telemedicine for members for the next 90 days and have also waived office visit copays related to COVID-19 testing. For those groups that insure with Aetna, CVS Health recently announced that they are waiving all cost sharing and copays for inpatient hospital admissions related to COVID-19 at all in-network facilities, and I would not be surprised if other carriers follow suit in the near future. For those insured by Anthem, Cigna, and United Healthcare, employees who previously waived their medical coverage do have the ability to now enroll with no waiting period. Aetna and MMO have yet to release any guidance, but once again, would not be surprised if they join the others. A question that is beginning to come up is with regards to how the carriers will be handling upcoming renewals. For some, this is an immediate question, and for others, it's months away. But as it stands today, Cigna has suspended all renewals and rate actions until a date to be determined. No other carrier has addressed the suspension of renewals, so at this point in time, plan on handling your renewal process as you have in the past. All carriers other than MMO for now are allowing organizations to restructure their plan designs if needed. With the 60-day grace period, this might not be of interest to you, but if you are willing to consider, let us know and we can communicate with your carrier. Regarding non-medical benefits, the ancillary carriers have also addressed the same issues as we have discussed, but because there are so many carriers, Mary is putting together an ancillary carrier grid that will be included with the slide deck that we email out to everyone. It will not contain every carrier that we do business with, so if you need a specific carrier not addressed, please let us know. Most ancillary carriers are allowing a 60-day grace period for premium payments, and most are allowing employers to continue and cover those furloughed or laid off. Well, one thing to note with almost every ancillary carrier, employees must be diagnosed with COVID-19 before a short-term or long-term disability claim would be paid. And as always, they have to meet the definition of disability as with any other claim. So at this point in time, I'm going to turn the call over to Wendy Ryan. Thanks, Wendy.
Thank you. And just like Brian, I'm working at home, as probably many of you are as well. So my husband is on dog duty, so hopefully we do not have a barking dog. We did in the last meeting, but we got fairly through it before he barked. So I'll apologize for that in advance. Before we flip to the next slide, I do want to just reiterate what Brian said. We've received a lot of information. I have sat through now 4 webinars that are attorney level webinars to address the emergency paid leave and the emergency FML. And there is still a lot of guidance that the Department of Labor has to give us. So everything we have today is as updated as we can get it. I just saw a Department of Labor update, but it doesn't give us the guidance that everyone's really looking for, but I'll address that when we get to the proper slide. Remember, these 2 pieces of the Families First Coronavirus Response Act are effective April 1. That's really key to remember as we go through this presentation. Next slide, Joe. So one thing that the Department of Labor is doing is they are giving a 30-day no enforcement period. So for the month of April, since this bill takes effect April 1st, they are not going to enforce anything that happens with these 2 bills, as long as you as the employer are acting in good faith and you are acting reasonably. So I know we all have a lot going on. We're trying to determine if our businesses can stay open. What do we do with our employees? How do we pay them, etc. For this non-enforcement position, good faith exists when, if you have a violation, they're remedied and the employee is made whole as soon as practical, and the violations weren't willful, and the DOL receives a written commitment from the employer to comply with the act. And I'm going to say the spirit of this act in all the attorney webinars I've sat through, which have been Voorhees, Littleton and Mendler, Scott, Warwick, and I just watched another one from our Zyway partner from their attorneys. The spirit of this act is really to help employees and employers through this national healthcare crisis we have. So as with everything, take the spirit of the act to heart, do things in the best manner you can with the limited guidance we have. Next slide, Joe. So for those of you that may want to take a picture of a couple slides before we get this slide deck out by the end of the day, this is one of those you're going to want to keep a snapshot of. This is just a nice grid that shows there are 2 pieces to this act. And these are just short synopsis of both of them. I'm going to talk about emergency paid sick leave first. Then I'll go back to the emergency paid FML, which is now being called FML Plus. So your emergency paid sick leave, and again, that is just a short synopsis. These 2 bills are going to have different eligibility rules. So which employers are covered under the emergency paid sick leave? Private employer with fewer than 500 employees, a public agency, federal, state government, political subdivision, and your schools. And for the emergency paid sick leave only, any other entity that is not a private entity. Next slide, thank you. So who is eligible? Now, these rules are different between FML and emergency paid sick leave. Under the emergency paid sick leave, your employees are eligible on day 1 of employment starting April 1st. So if you hired someone, let's say March 31st, if you're hiring right now, and that employee comes to you April 1st and says, I meet the criteria to take emergency paid sick leave, you have to allow them to do that. There is no waiting period for this. That applies to your part-timers, your full-timers, and variable hour employees as well. So this is another slide you're going to want to maybe take a snapshot with your phone. This is going to be one that I refer back to many times. Excuse me. And these are color coded for a reason. So your turquoise first 3 bars, 1, 2, and 3, the color coding will apply to how much money they get paid and why they get paid. So these top 3 reasons that an employee can use emergency paid sick leave, you'll notice are regarding the employee specifically. The green reasons are for an employee's family members. And a key note at the top of this slide, this act requires your employees to be unable to work or telework. So we're all teleworking now, those of us that have the ability to do that. If you have a job, you're at Kroger, or let's say FedEx, or you're in a manufacturing plant, and you meet the criteria for 1, 2, or 3, you can't telework. But let's say you have a worker like our office, we're all insurance, we're essential employees, we're an essential business. We are able to telework. So you want to pay really close attention to that telework term, because if your employee can telework, they probably are not eligible for the emergency paid sick leave. It's a really critical term right there. And so these rules, as we look at, number 1, your employee is subject to a quarantine or isolation order. There is no definition yet on the shelter in place order right now, whether that qualifies. Number 2, your employee is advised by a healthcare provider to self-quarantine because of COVID-19. So I shared this in the first meeting, and I think it's relevant. Our daughter works in the ED at Ohio State. She's been obviously exposed to all these patients. Well, she called us Wednesday night, and she was sent home to self-quarantine because a patient she had been treating probably has COVID. So that patient is now being quarantined on OSU's COVID floor. They're being tested, and Ariana will find out whether that patient was positive or negative, which will dictate how she proceeds with her having to get a test. But that's an example of that employee was advised by a healthcare provider to self-quarantine. That's not employee self-quarantining themselves because they think they have symptoms. Which the third point is the employee is experiencing symptoms of COVID and they're seeking a medical diagnosis. So they're using telehealth, we hope, or they're going to their PCP to get that diagnosis and then get their order to go through a drive-through testing site. Those are the 3 reasons for an employee to get 100% of their pay under the paid sick leave mandate. The last 3, green, the employee gets a lesser amount of pay. So number 4, the employee is caring for an individual who has been advised to quarantine. Notice that says individual, not family member. And this is a really sticky point in the bill. That can mean, because we're all doing a little bit of type of working now, I may be caring for my neighbor. I may be caring for a parent, brother, sister. It's not just a family member that I am caring for who has been advised to quarantine. Number 5, I am going to refer to a lot. The employee is caring for a son or daughter whose school or place of care, so their daycare center, is closed. We know all of the schools are closed right now. Most daycare providers are closed as well. This is the only reason that emergency paid sick leave and FML plus will intersect. That is the only reason. And we'll talk more about that as we talk about FML plus. And number 6 is kind of a catch-all. The employee is experiencing substantially similar conditions as specified by the Secretary of Health and Human Services. So that's kind of a catch-all. Next slide. So we're going to dive into a couple of these as they get a little bit more intricate, if you will. And again, we go back to that telework definitions. Who gets to decide whether the employee is able to telework? Well, the Department of Labor hasn't given guidance, but we assume it will be you, the employer, because you know the capabilities of your employees and your business readiness plan, whether you have the laptops and the equipment for them to do that. Reason one, we've talked about, that's easy. Reason two, that employee is advised by a healthcare provider to self-quarantine. So let's say that employee then gets COVID and they are now out with a serious medical condition. Do not forget, regular FMLA, our good old classic FMLA, doesn't change in any way, shape, or form. Classic FMLA remains. If a patient or employee is out under reason two, under emergency paid sick leave, they will probably qualify for regular FMLA due to a chronic condition. So they would get paid for their first 10 days under emergency paid sick leave and run that under classic FML concurrently. We'll touch on that a little bit more. Reason three is simple. We know that one's pretty straightforward. So next slide. So reason four, we go back to the statutory change in the language from family member to individual. And again, the spirit of this law is to give you and your employees the ability to take care of themselves, take care of those that they may be helping in a quarantine or isolation situation. So it doesn't have to be husband, wife, kids, mom, dad. Reason five, and we will talk about this quite a bit. So as I said on the earlier slide, this is the only emergency paid sick leave reason that intersects with FML plus and extends a full 12 weeks with some level of pay. So this one is really important, and you'll probably get a lot of questions from your associates on this. Reason six, we know, kind of a catch-all. So I'm not going to spend any more time because we don't have any more guidance on that. So next slide. So questions. I've gotten lots of this from my customers. How do we document, A, that they're taking emergency paid sick leave, or they're taking FML plus? What's needed? How do we do this? DOL has not given us any guidance on whether you can request documentation or what documentations you should have your employees provide to support the need. And let's not forget, FMLA has never before covered school or child care closings. This is a new area for us. So medical related absences, remember, classic FMLA, but you may want to relax your medical certification rules because you don't want that patient who is already sick to go back to a provider and have FMLA paperwork completed. If that could be done electronically, that's fine, but we don't have guidance on this yet. So in a non-medical absence, same thing, we know that every school's closed. Likely, the Department of Labor is going to come out with some guidance, but right now, you could ask for an email or a text message that the child's school or daycare sent you. There's a closure announcement on all of the schools. Maybe you provide that. Or an employee statement that, hey, my child care closed, or my child was put into a quarantine or an isolation order. So remember, this is all still up in the air. And again, under the spirit of the law, you can relax those requirements for documentation. It's up to you right now until the Department of Labor gives us more guidance. So let's go to the next slide, Joe, and we'll talk about how this thing actually works. So how much emergency paid sick leave is provided? How is it paid? So all full-time employees get 80 hours of emergency paid sick leave. Part-time employees, you have to look at the number of hours that that employee works on average over a 2-week period. Varying work week employees, if you have variable hours, you're going to do a 6-month look back on their wages and average that. So how much do they get paid? And we'll talk about on the next slide or two how you, the employer, get reimbursed for that. So remember that chart with the turquoise and the green. That chart is important because, as I said earlier, it ties in color to what they get paid. So if their reasons for emergency paid sick leave are reasons 1, 2, or 3 in the turquoise color grid, they get 100% of their regular rate of pay to a maximum of $511 per day, so a total of $5,110. Remember, those first 3 reasons are because the employee needs the leave for themselves. Reasons 4, 5, and 6, which are for an individual or their children or family members, that employee gets paid 2/3 of their regular rate, maximum of $200 per day, for a total of $2,000. So the reasons make a very distinct difference in how much is paid out to the employee. So how is this paid and how do we interact with other leave laws? The Department of Labor has made this point pretty clear. You have to allow the employee to use the emergency paid sick leave first. You cannot require that employee to use any accrued sick leave, PTO, vacation. Absolutely cannot do that. Even if you have a unlimited PTO policy, unlimited sick pay, doesn't matter. You have to allow them to take this first. Can you allow them to accrue or use their accrued leave to top off that 66 2/3% for reasons 4, 5, and 6 to get paid 100%? Absolutely. So you could do that if you choose, and if they have accrued leave. So you'll have to look at your leave policy and how that intersects. So this last bullet point, we had some of our employer groups when this bill came out and it was originally approved and passed that said, hey, I have employees that need this. I'm going to put employees on this emergency paid sick leave. Because you were more generous and the bill was not in effect because it takes effect April 1, you will not get reimbursed for those monies via the payroll tax credit. So although you were more generous, at least at this point in time, and the most recent webinar I sat on at 1 o'clock today said the same thing, you will not get reimbursed. The bill came out, it was passed, but it did not take effect until next week on April 1st. So one thing I really want to make a point of on the emergency FMLA, again, as it's being called FML plus, this bill does nothing to change FML Classic. So let's go to the next slide, Joe. So I can't stress this enough. FMLA as it stands is still in existence. You still have to administer FMLA. All this does is amend FMLA Classic to allow paid time off because the schools are closed and daycare centers are closed. That's all it does. So there's one reason to use FML Plus, and it's only because daycares and schools are closed. Nothing else at all applies to FML Plus. So what are the eligibility rules for this? Private employer with fewer than 500 employees and your public agencies, which we covered. However, which employees are eligible? Any full-time or part-time employee that has been on your employer's payroll for 30 calendar days. Now, this bill starts April 1st. What we don't know, and the webinar I was just on said the exact same thing, the Department of Labor has not clarified, does that 30 days start from March 31st and go backward or not? I would assume yes. So if you have somebody who's been on your payroll since March 2nd, and they have a child who is out of school or daycare is closed, on April 1st, they could apply for FML Plus and you would approve them. That is the only eligibility requirement for FML Plus. That's it. It's period. You completely dispose of the year of service, the 1,250 hours in the last 12 months, and the 50 employees in a 75-mile radius requirement. All those rules go out the window. FML Plus, if they've been employed and on your payroll for 30 days, they are eligible for this coverage. So I can't stress enough, this is only for that lack of child care. And this was put into place, again, spirit of the law, for a qualifying need related to a public health emergency. So we go back to this definition: when an employee is unable to work or telework to care for a minor child. Has to be a minor child. So remember that telework definition. For those of you like Brian who has small ones at home, he's still able to telework. So he's not going to qualify for this because he can still do his job. This allows for 12 weeks of FMLA plus leave. Now, we have every reason to believe, unless the Department of Labor tells us differently, that this does still mean 12 weeks combined for all FMLA reasons in the employer's 12-month period. So let's think about, what is your 12-month FMLA eligibility period? Does the employee that's requesting FMLA, for those of you that are 50 full-time employees or more, does the employee requesting even have FMLA available? Most employers are doing a rolling 12-month look back eligibility on their FML. So you still have to verify if the employee requesting FML Plus has any FMLA available. So if your rollback started June 1st, you're going to look back June 1st of 2019 to May 30th of 2020. If that employee has taken their full 12 months of FML Plus, the way the bill says today, does not allow them another 12 weeks of FML Plus. It's one bucket. So you have to make sure you verify their FML eligibility for that purpose only. So the other question that has come up, and we've seen some varying responses on this, and we hope to get some more clarification, but all the attorneys I have listened to said, can we as an employer require spouses who both of them work for us to split the emergency paid sick time? So Joe takes 6 weeks, Jessica takes 12. Yes, you can do that. Unless other guidance is released, you can ask them to split that. That kind of goes up to the bullet point before. You may need to do that if one of those employees that has worked for you, and they're a couple, has used more or less FML than the other. So how does this 12-week period work? The first 80 hours are unpaid FML plus. But I go back to number 5 on the first colored chart. An employee could qualify for emergency paid sick leave, reason number 5, which is caring for their child who is out of school and their daycare is closed. So they can have emergency paid sick leave at 2/3 of their pay during that first 10 days. You will run that concurrently with FML Plus, because that way your employee for the remaining 10 weeks of FML Plus, they get paid at 2/3 of the employee's regular pay rate for the number of hours they would have otherwise been scheduled to work. Remember the difference here, that emergency paid sick leave is going to pay them for those first 10 days up to $511 a day, when that remaining 10 weeks under FML Plus gives them $200 a day. but this does allow that employee to get the full 12 weeks paid. So that is a benefit to that employee for using emergency paid sick leave because they can't work or telework because their child's out of school. So here is something we are waiting on guidance for. The law currently exempts employers with fewer than 50 employees from civil damages and FMLA litigation. Why is that? Remember today, small employers have never administered FMLA, they're exempt from it. But as of today, until the DOL tells us otherwise, and they are hoping to release guidance on this, they are hoping to exempt employers under 50 from the FML plus. That hasn't happened yet, but we are hoping to see guidance in the next few days. So think about those employers that are under 50 and they've never administered FMLA. They don't even understand it probably. They have to administer FML plus. So that opens up a whole can of questions. What forms? How do my employees request it? How do we track it? So we will update you as we continually get information. I am seriously hoping the Department of Labor gets a good update out there that's helpful to us in the next, at least by next weekend. So this is another kind of sticky point. Healthcare providers and first responders. So the best read of this statutory language right now is an individual employee, not an overall employer, opt out of emergency paid sick leave and FML plus. So, you know, if you're a healthcare provider, you're a doctor's office, you're a healthcare center, you know who your healthcare providers are in the broadest definition. Your physicians, your nurses, your nurse practitioners. You need to carefully evaluate your case-by-case assessment of how closely they are tied to the provision of health care giver. Right now, if you're a doctor's office, you should not entirely be shutting down your operations because those healthcare providers are first-line employees and first responders, essentially. They need to be on the front lines. Right now, the Department of Labor has said those emergency responders and healthcare providers are not eligible to take emergency paid sick leave or FML plus. However, in those medical practices, you have payroll, you have human resources, you have administrative staff, you may have medical clerks, record clerks, billing clerks. They are all eligible for FML plus and emergency paid sick leave. So you have to remember that even though your healthcare providers and first responders may not be eligible, your administrative staff are. So you want to make sure if they request this, you offer it to them. So here's the summary of tax credit. And this, I'm sure, will continue to be updated with more specifics, but you will take a refundable tax credit equal to 100% of the qualified paid emergency paid sick leave and FML plus. Well, how do you do that? You're going to recoup those monies from payments immediately by keeping a portion of the deposit you would otherwise pay as part of your employee's federal, Social Security, and Medicare taxes. Now, what I just learned from the webinar I was on at 1 o'clock, let's say you didn't have enough of those employees' federal, Social Security, and Medicare taxes to immediately reimburse yourself or retain those essentially. You can apply for an immediate reimbursement from the IRS. So this at least allows you, as you're trying to cover those employees on these two plans, you retain those monies, and so you aren't paying them and not getting them back. So kind of an overall summary. Remember, public and private employers with fewer than 500 employees must provide FML plus and paid leave to your employees, all right? That includes the emergency paid sick leave. Full-time and part-time employees get 80 hours of emergency paid sick leave. Remember, though, that emergency paid sick leave is capped $511 a day to a max of $5,110 for the reasons 1, 2, and 3 on that chart, so the turquoise reasons. Emergency paid sick leave is capped at $200 per day, up to a max of $2,000 for leave taken to care for a covered family member, reasons 4, 5, or 6 on that chart. Employees who have worked for the employer for 30 or more calendar days, eligible for FML plus, emergency paid sick leave, they're eligible immediately as of April 1st. Both FML and emergency paid sick leave provide leave, again, for closure of the schools and daycare facilities. So rule number 5 is why you would use both of these. That FML Plus provides 12 weeks of job protected leave for the employee's use, again, due to the reason above. That's the only reason you're going to use FML Plus. The first 10 days of that FML Plus is to be unpaid. Employees can elect to use accrued paid leave for those first 10 days, but you can't force them to do so. And remember that FML Plus should run concurrent with the emergency paid sick leave, or it could. Therefore, they are getting paid for those first 10 days if you do that. But remember, after those first 10 paid days of FML Plus, the remainder of the leave is paid. And it's paid differently. So the first 10 days, if they're using emergency paid sick leave, again, it's $511 max per day. After the first 10, they get $200 per day max. For employees whose schedules are variable hours, and I said this a couple slides ago, but here's the calculation. You're going to take the appropriate number of leave hours by taking the average number of hours worked per week during the 6 months before the employee is to start leave for both FML Plus and emergency paid sick leave. So you're going to have to do a little bit of calculation to determine how much your variable hour associates are eligible for in pay. Part-time employees receive paid sick leave equal to the number of hours they work on average over a 2-week period. Remember, employees receive only 2/3 of their pay for FML Plus and emergency paid sick leave for care of a family member. So reasons 4, 5, and 6. So before we close out, one thing that I've had the question of is, how do we track this leave and how do we designate leave? Do my employees fill out a form? We don't know yet. The Department of Labor has not given us any guidance. What I've told my groups is mark it as emergency paid sick leave, however you would do your normal request for time off. Make sure you designate this leave, even though you employers are getting immediate reimbursement of what you're paying them. We don't know if down the road you're going to have to report somehow who took it and how much they took back to the IRS. So designate it as emergency paid leave until we get further guidance or until there's a special form. What I will say is the Department of Labor did release a model notice on their website on March 25th that you as the employer are required to post, just like you do all your other normal Department of Labor posters. There was guidance released today about, hey, we're teleworking. There's a new FAQ out on the Department of Labor's website. That's why they are first on this resource list. It does have an additional notice that you need to post, and it's an FAQ as well. SHRM.org is a great resource. They have put out additional guidance. Insurance.ohio.gov, this is the Ohio Department of Insurance website. In the event our governor issues any more orders related to insurance that Brian touched on in the first part of the presentation, if anything else comes out, that's where it will be posted. We will continue to update you as we get advice, resources, we get guidance from the Department of Labor. I will say that we are planning to do another version of these WebExes next week. Date, I think, and time to be determined, but it will be on the new stimulus bill that was this afternoon finally signed completely through Congress. So that was a $2 trillion bill. Tammy from our office is going to lead that charge and make that presentation. But just know we're here to keep you as updated as possible. So Joe, if you can flip to the next slide. As Brian said in the beginning, we do want to get as much information out to you. So we are reserving questions for after our webinar, and you can email those to info@prefben.com or mary@prefben.com. Mary will send out the slide deck before end of business today, along with the carrier grid that shows what the carriers on the medical and the ancillaries are doing as far as the 60-day premium grace period, et cetera. We're going to compile all of the questions we get and send that out next week. Thank you so much for attending. Everybody stay safe and well and have a great afternoon and a great weekend.